It's been almost a year since the outbreak of COVID-19 in South Africa. Facing the pandemic, we've had to adapt, protect, and adjust the way we live and work. Now, almost a year later, we South Africa have been hit with a second wave, along with a new variant of the virus. What does this mean, and how can we make sure that we're doing the best to protect our families? We chat to Infectious Disease Specialist Dr. Emile Reid on what we need to know about the second wave. We also have Nicole Austin joining me again in the loft as the health correspondent. Welcome back to the loft, Nicole.
Thanks, Palesa. Great to be here and talking about something so topical. We need to adapt, we need to learn a lot of new things about this virus, and we need to keep one another safe.
And as a pharmacist, that's exactly the kind of perspective I want coming from you throughout this conversation. And for you, Dr. Emile, welcome back to the show. Now, what catapulted the second wave in South Africa?
The first thing that caused these big problems is because we underestimated this virus. People thought that COVID-19, after the first wave, was a thing of the past. They became relaxed. And also people thought that SARS-CoV-2 cannot survive in the hot weather. Also at that point, all of us became tired of wearing masks, so-called COVID-19 fatigue, and therefore not adhering to mitigation strategies and guidelines. Also, the time coincided with summer, end of the year, festive holidays, when mass movement and travels occurred interprovincially and also internationally. Mass gatherings over the same period served as super spreader events, igniting a massive second surge in cases of COVID-19, hospitalizations, and unfortunately deaths.
Doc, we want to know specifically, the fear around this disease is immense, and now suddenly there's this second wave. How is the second wave different to the original outbreak?
Well, first of all, Nicole, the second wave came much sooner than initially anticipated and expected. Also, it affected more young adults, and the numbers just spiraled out of control. Although healthcare professionals were more experienced in management and of this disease and taking care of patients, we were also better prepared. But unfortunately, the volumes of cases overwhelmed our hospital systems. We had shortages of beds, which led to increased mortality and also increased morbidity. At the same time, healthcare providers were ill. They were burnt out and they couldn't carry on because they've been at it for the last year. Beds and quality of care was probably our biggest commodity.
And what we did see with the second wave also attracted a second strain of the virus, which came out of South Africa. Now, can you both just help me understand the second strain and what should people be aware about it?
The first thing one needs to remember that there's a big difference between a strain and a variant or mutation. And if it was a different strain, I think we would have gone back to the start of COVID-19 a year ago, and would things have been completely and utterly even more chaotic. So what we're dealing with is what we call a variant. And important to remember that viruses are extremely error-prone. So with every division or replication cycle, viruses develop mutations, and that happens all the time. But certain mutations or certain variants are more significant than others. The so-called 501YV2 is one of those type of variants. And what we found that with this new variant, we had massively increased virus loads in patients contracting the disease, which also led to rapid transmissibility, an increase in transmissibility of this disease. Hence the reason for the numbers to spiral out of control. Also, the influence on disease severity, morbidity, and whether it actually increases mortality We are not quite sure at this point in time and need to look at the data that we have accumulated in the last few months. Nothing that we didn't do with the first one will actually make a difference, because we need to go back to what we know best, and that is the mitigation strategies to mask up, physical distance, and sanitize.
Well, I think that's exactly it, is on the front line, especially in pharmacies, this second strain or variant has actually created a lot more awareness, and people have realized that this is a serious disease to contend with and to lose that apathy that was developing.
Yeah.
Doug, so now that we see that the second wave is starting to stabilize, where to from here?
Nicole, that is a fantastic question. I think the one thing we need to understand is that the only way that we can get out of this predicament that we're in is through the development of herd immunity, or so-called population immunity, which can only be achieved through wide-scale vaccination programs. So we need round about 85% of people to have antibodies or to be vaccinated against this particular virus before we will develop herd immunity. Meaning, in South Africa, we probably need 45 million people to be vaccinated in the next few months, meaning 90 million dosages of vaccine. Without a vaccine and without getting to herd immunity, COVID is going to be around for a long time.
So thank you, Doc.
Absolutely. Thank you very much.
Goodbye, Doc.
Thank you, Pelisa. Keep well.
Goodbye. We're going to have Dr. Emile Reid back in the loft, Nicole, as we speak about his personal experience with COVID-19 and how he survived, which brings me to the competition that we're setting up with Immuenza, wanting to find out from South Africans their survival stories.
Yes, exactly. And I think there's so many of you brave South Africans out there who have gone through the most, not just with COVID, and we want to hear your stories.
Absolutely. So, Mzansi, you heard it from Nicole. Do you have a survival story? Then we want to hear from you. Share your survival story with us, from surviving a failed parachute to a lion attack. We want to hear your story, Mzansi. Immuenza is giving away 5,000 Rand a week for 5 weeks. All you have to do is reply to the Immuenza competition post on the Afternoon Express Facebook page or Twitter page and tell us your survival story and what protected you. Using the hashtag Immuenza. Competition closes on the 17th of February 2021 at midnight, and terms and conditions can be found on afternoonexpress.co.za. So get entering. Support your immune system for your next big adventure with Immuenza.